Arthritis is a common condition that causes pain and inflammation to the joints. There are many different types of arthritis, but the most common types are osteoarthritis and rheumatoid arthritis. So let's start off with osteoarthritis, or OA. Now, this is the most common type of arthritis and it affects up to a third of people in the UK over the age of 45. It's also known as wear and tear, and that's because the cartilage that cushions the ends of the bones can start to become worn. And this results in changes in the underlying bone that can result in pain, swelling, and difficulty in range of movement off that joint. The risk of developing OA increases as we age. It's also more prevalent in females and in those with a family history of it. Furthermore, obesity can add to your risk factor of developing OA, and that's because of the pressure that is put on the joints when there is excess weight. Whilst there's no cure for OA, there are ways to help manage it and avoid its progression. Lots of people worry about exercising with OA, thinking that it might make their joints worse, but actually by doing joint-friendly exercises, you will help support those joints. So that's things like walking, swimming, cycling, strengthening exercises. And if you have any confusion at all, a physiotherapist will help give you more of a structured plan. Some people may also benefit from aids like walking aids, splints, and bandages. If you're suffering from pain, then over-the-counter or prescription medication may also be used. And if that is particularly bad, some people also benefit from steroid injections or even surgery to replace those joints. Rheumatoid arthritis is less common. It affects about 1% of the population, and it is an autoimmune condition, which means your own body mistakenly attacks the healthy cells lining the joints, which can result in joint pain, damage, and erosion. Rheumatoid arthritis most commonly affects the smaller joints of the hands, feet, and wrists, but can affect any joint, and it can even affect your heart, lungs, and eyes, resulting in a higher risk of things like heart attacks and strokes. Whilst the symptoms can seem very similar to that of OA, there is a higher risk of developing deformity of the joints, but you can also get more systemic symptoms like fatigue, weakness, weight loss, fever. Whilst we don't know the exact reason that some people develop RA over others, we do know that you're at higher risk if you're female, if you've got a family history of it, and if you are a smoker. RA can be stable for a period of time and then flare up. And whilst there's no cure, the aim of treatment is to increase that time in between flares to help reduce the damage to the joints and also to help improve mobility and quality of life. And this is why it's so important that we have early recognition of the condition, early referral, and early treatment. There are two main treatments for RA, and that includes a medication called DMARDs and medications called biologicals. DMARDs work by suppressing your body's immune and inflammatory responses to reduce the amount of damage to the joints. Biologicals work by blocking the pathway that activates your immune response, also reducing the damage to the joints. Some patients only need either a biological or a DMARD, and others require the two in combination. If you do develop a flare whilst on these medications, other forms of treatments include non-steroidal anti-inflammatories, painkillers, steroids, and injections. And many people also require the support of a physiotherapist and an occupational therapist. Some may even require surgical intervention. I also recommend that, as with any other type of chronic illness, you also get psychological support and the support of others with the condition, as it can feel very debilitating.